Good afternoon. I'm Monica Hendrickson, Public Health Administrator for Peoria City County Health Department, and welcome to our weekly COVID-19 update for Thursday, October 28th. For the Tri-County region, we currently sit at 53,860 total cases. That is an increase of 370 over the past week. That includes an additional 175 cases in Peoria, 128 cases in Tazewell, and 67 cases in Woodford. Our to-date totals for deaths is now at 832, which is an increase of 4 over the past week, which brings Peoria County to 405, Tazewell to 321, and Woodford remains at 106. Compared to the previous week, where we had 552 individuals at home and isolating, this week we are down to 455 active cases in the Tri-County at home and isolating. And additionally, we dropped in the number of hospitalizations over the past week. Last week we were at 26 Tri-County residents in the hospital, and today we are at 20. The 7-day average for the Tri-County and for Peoria County both decreased over the past week. The 7-day average for the Tri-County is now at 53 new cases daily compared to 61. And for Peoria County, it is 25 new cases daily compared to 33. Similar to last week, majority of our cases are still under the age of 39. We saw a slight decrease to 58.8% versus 60% last week. Interestingly enough, though, we are seeing increases in the number of cases in our over 60 population, which is important because we want to reiterate the fact that all 3 vaccines, Pfizer, Moderna, and Johnson & Johnson, have been approved and are available for boosters for individuals 65 and older. Again, this is a group that was early on a high-risk population that we wanted to get vaccinated quickly. And now we need to work with them on getting their boosters so they can maintain that level of immunity as we continue our road to recovery. Overall, our hospital systems of OSF St. Francis Medical Center and UniPoint Health Central Illinois currently have 7 ICU beds in use and 47 non-ICU beds in use. Saddened to report 1 death in the past 24 hours. Similar to the case counts we saw in the Tri-County and in Peoria, the 7-day average for ICU and non-ICU beds decreased over the past week. The 2 hospital systems are now averaging 14 ICU beds in use and 32 non-ICU beds in use. This past week, we've seen some exciting news, starting off with the FDA's advisory committee approving Pfizer for ages 5 through 11. This, again, is the first step in a multi-step process before we can get that vaccine into the arms of our 5 to 11-year-olds. To speak more about the importance of getting vaccinated, especially for that population, we have Dr. Nora Philbin, Associate Medical Director of Pediatrics for UniPoint Health.
Thank you. So I just wanted to remind ourselves the impact that COVID-19 infection has had on children in this age group, right, our 5 to 11s. So even in the last 6 weeks alone, we've had 1.1 million children diagnosed with COVID-19 infection, and 600 million children in the U.S. have gotten COVID-19 infection. Hundreds of children have died of COVID-19 infection, and over 150 of those children were between the ages of 5 and 11. The other consideration in this age group, and for all people under 18, is that children can also develop multi-system inflammatory MISC after having COVID-19 infection. And there have been more than 5,000 children who have developed MICS as a result of having COVID-19 infection. So I just wanted to start there and to remind ourselves the impact that this COVID-19 infection can have on children. Some of the questions that we have been fielding from parents about this vaccine and this vaccine in this age group is the concern that, that the vaccine was rushed, that there were shortcuts taken. So I'd just like to address that quickly. I want to emphasize to everyone that there were no shortcuts taken in making these vaccines, and it was a collaboration of scientists all over the world and a great amount of teamwork, energy, and impetus to get these vaccines made. So they weren't rushed, and there weren't any shortcuts. The other question that I get from parents often is the technology is too new, the mRNA vaccines. So again, to address that, I just want to remind everyone that the technology for mRNA vaccines is decades old. People have been investigating this for years, and more than that, scientists have been looking at coronavirus in particular also for decades, right? So though the vaccines are relatively new, the technology is not. Then I get many questions from parents about effects on fertility and puberty. And again, I just want to reiterate for everyone, there has been no data that has shown that there has been any effect on fertility or puberty in any children, in any of the studies, in any of the real world use of the vaccines over the last 18 months. And also there was no indication in the safety data or the animal trials that there would be any effect on fertility or puberty. So again, I just want to let people know that is not a consideration in these vaccines. That's just not true. The other question I get often is about the risk of myocarditis. So myocarditis is an inflammation in the heart muscle that has been seen in a small population. It's a very rare side effect that can be seen. It has been overall mild. It has been transient, and people who have developed it have gotten over it quite quickly. And the risk of getting myocarditis is actually higher with COVID-19 infection than what we've seen with the COVID-19 vaccines. So that's where I just wanted to start it. So if people have more specific questions, I'd be happy to answer them for you.
Are you seeing an increase in parents who actually want their kids 5 to 11?
Oh yeah, absolutely. Yes, absolutely. I've had several parents ask me, when can my child be vaccinated? When will it be available? So I've answered for them that, yes, we've had this recommendation from the vaccine committee at the FDA, but it still needs to be approved by the FDA for emergency use authorization. And then it needs to go to the CDC and their advisory immunization practices, the ACIP committee. They will also put out a recommendation, and then it would be approved for use. Even more so, then we have like the American Academy of Pediatrics will come out with a recommendation on whether they think it should be used or not. So we've got a couple steps yet. That's what I keep telling them. Yes, we're hopeful this is coming, but not quite yet.
And the local hospital systems have already taken, have already sort of, they've already been proactive by ordering vaccine, pediatric vaccine.
Correct. Correct. So there has been pre-order of the vaccine specifically for children because it is a different formulation. There has been pre-order done by Unity Point Health. The plan is to, when we're ready, to roll it out through our pediatrician's office and our in-school health centers. But yeah, the mechanics is starting already.
And then once that actually gets approved, how will the school systems fit into this? Will they be able to get the vaccines at schools as well?
That's the plan, at least through Unity Point Health. We'll be using our in-school health school clinics in order to help roll that out. Yeah?
Oh, sorry, I have a question.
Sure.
As far as the rollout with schools, once there's an official recommendation, how will it affect children who opt out of getting this vaccine?
So I think that will just be a matter of the parents' decision, right? So if they choose not to get the vaccine, they choose not to get the vaccine.
Do you see if a lot of children at schools get vaccines, do you see masks starting to come away because of that?
Say it again.
Do you see masks starting to come away if a lot of students get
I don't actually, to be honest, right? So the recommendation currently from the CDC is even vaccinated people still need to wear masks. And until that changes, I don't think kids who get vaccinated will not be wearing masks anymore.
I do want to follow up on the second to last question about the impact. You know, one thing to recognize is that when an individual is vaccinated, whether or not they are exposed to someone and their options of quarantine very much is dependent on their vaccination status as well as their symptomology. So, you know, I agree that, you know, masking might not go away immediately with the uptake of vaccinations because, again, we have to get the entire community's virus levels down for unmasking to happen. And if only a few people take on vaccinations, then, you know, we're still working upstream. But if your child does get vaccinated and they are exposed, you're going to see much more options available for them in terms of whether or not they need to quarantine if they were exposed. The other discussion that came up this week was related to our daycares and our early childhood providers in terms of vaccinations as employers. And so to speak more about that, we have Brenda Lee Smith, Director of Resource and Referral for SAL Child Care Connection.
Well, thank you for this opportunity to talk a little bit about the Illinois Child Care Resource and Referral System, our new executive order for licensed child care centers and resources for our early care and education workforce. Let's start with who we are and how we can support the early care and education workforce. We are a coordinated system in the state of Illinois of 16 agencies. Locally, I'm with SAL Child Care Connection, one of those 16 agencies covering all 102 counties. We cover the central 9 counties up from LaSalle and Bureau, Putnam, Marshall, Stark, our heaviest populated counties of Peoria, Tazewell, and Woodford, and down to Fulton. So let's talk about our workforce in the state of Illinois. We currently have in our 9 counties, we have 97 licensed child care centers, 144 licensed child care homes, 41 license exempt centers, and 241 license exempt homes. License exemption is legally operating child care that does not fall under the guidelines of the Department of Children and Family Services. On Friday, October 27th, Governor Pritzker provided us with the executive order to prevent the further spread of COVID-19 and to protect young children who are not yet available to have the vaccination. For Peoria County, this impacts 33 licensed child care centers, providing care to just over 3,500 children between the ages of 0, birth, and 12, with the majority of those children being between the ages of birth and 5. That's a workforce of just under 500 early care and education providers or teachers. Right after the executive order came out, the Illinois Department of Children and Family Services provided additional direction through the Restore Illinois guidance for our licensed child care centers. That guidance and process includes on who should be vaccinated, and that's all licensed child care providers need to have at minimum the first dose of a 2-dose COVID vaccine series or a single dose COVID-19 vaccine by December 3rd of 2021, and the second dose of a 2-dose COVID-19 series vaccination by January 3rd of 2022. By December 3rd, in order to enter into a child care program as a staff member, if they are not fully vaccinated, they do need to comply with testing requirements. The testing requirements put out by the Department of Children and Family Services include using a test that either has emergency use authorization or laboratory approval through Medicaid or Medicare, and they must provide proof of that vaccination. The Illinois Department of Public Health also recommends that it is a PCR test. There are exemptions for licensed child care staff members who have a waivered medical condition or religious exemption. and then they follow through with testing on a weekly basis. How the resource and referral system in the state of Illinois and centrally with SAL Child Care Connection is supporting our early care and education workforce to maintain staff so that families have access to affordable quality child care options. Communities have rich data and resources for small businesses to maintain their employees. And of course, the support to providers, especially around COVID-19, will be information about eye care, the Illinois Comprehensive Automated Registry Exchange, and Vax Verify, if they need documentation of their vaccination status. Information on the Illinois Department of Public Health website for accessing COVID testing sites, and vaccines.gov for vaccination sites, and then the Midwest Coordination Center, which is funded by the U.S. Department of Health and Human Services, which will coordinate testing efforts within congregate settings, such as child care facilities, to handle the supplies, the shipping, and the results via a portal, electronic method, so it is quick and easy within 24 to 48 hours for staff to maintain the rules around the executive order. So in closing, I want to share with our early childhood field, we have been through it all. We have supported all of the other workforces in Illinois and across the nation, with the foundation being maintaining healthy and safe learning environments for young children. So if I could answer any questions. Okay, thank you.
Open up to any questions.
I wanted to ask about potential side effects of the booster.
So potential side effects of the booster, we've seen a similar range as to when the initial vaccinations happen. Sore arms, which is natural, maybe kind of a tenderness in that area. But how you, the same type of effects you had maybe in your first and second dose, slightly milder for some have not noticed anything, so it can kind of have the spectrum. So really expect similar to what you've had your first round, if not slightly less.
Can you go over the steps we need to hit once more before we can get the children's vaccine out?
So prior to getting the 5 to 11 Pfizer vaccine out into the arms of children in our community, the Vaccine Review Board at the FDA has already made their recommendation and approved it. The next step is actually for the FDA itself to do that emergency use. That then moves next week to ACIP, which is Advisory Committee on Immunization Practices, which is part of the CDC. Once they meet, and I believe they're meeting on October 2nd and 3rd, once they make their recommendation, it moves over to the CDC director. Once she reviews it and makes her recommendation, then we will look for updates, as well as, because it's a pediatric, we often take into account what the Academy of Pediatricians will say as well, and we will advise our standing orders. So it can be a very quick turnaround once that news hits. To the point that was asked earlier, the mechanics have already started. You know, we already have done our pre-ordering for our community. We know kind of where the placements are going. We've already been working with our community partners about where sites should be. You know, we're balancing locations with also staffing levels. And so, and we're not getting, you know, necessarily a large enough allocation right off the bat. To give perspective, Peoria County census for 5 to 11-year-olds is 15,000 individuals. And we were able to order about 300 at a time as providers. So again, we hope to be able to have such an interest that we can continue to order as much as possible. That would be wonderful for our community. But we do feel that we have enough coming into our community that those people that are really eager will be able to get it as early as, you know, November 8th, if not sooner.
And can you give me like a timeline, maybe 2 weeks, a month, for all of those steps to hit, maybe even a week?
So once the CDC director makes her recommendation, it depending on how fast standing orders are updated, it can be the next day.
How long until she makes her recommendation?
She'll be making it next week.
Thank you.
And only certain, the booster shots are only recommended for certain groups of people. Is there any information on when that will be available for the general public?
So the balancing of when booster shots would be made available for the general public. Right now, I will say, in all honesty, the booster guidance is pretty easy. There's two groups that should get it, right? The over 65, because of their high-risk population in terms of having severe illness or death, really should be getting their boosters, as well as individuals that are older with underlying conditions. But then the May group includes anyone with any type of underlying conditions, which is a large list: diabetes, obesity, heart disease, so forth, as well as those that work in congregate settings, such as jails, childcare facilities, schools. So it is a pretty large population that it already does cover right now. I think when it becomes just open to that general public, so to speak, is going to be a question when we start looking at the fact that we have to remember this is a pandemic, which means it's global. So we have to make sure we understand that our vaccine supply also needs to be equally available and not just put to those countries that can afford this, but in an equitable way so that we can all get out of this. I don't have a degree in economy, but we do recognize there is distribution shortages, and that's because things that are made are in countries that are shipping and moving, and for our entire globe and even our U.S. economy to come online, we have to get everyone vaccinated or have the opportunity to get vaccinated.
And then last week you mentioned that there was an outbreak at one of the long-term care facilities in the area. So, and then you say you're seeing more illnesses in those 60 years old and older. So what is the push to get those vaccines, the booster shots, into the long-term care facilities and into that population?
So the question is, what was the kind of game plan for getting boosters into our long-term care facilities? So early on, when we did the first round of vaccines, the federal government, through our large pharmaceutical companies, Walgreens and CVS, actually went to those sites to set up boosters. Similarly, IDPH worked with them this time around to make sure that they had access to boosters. So all of our long-term care facilities in our area had access to boosters. Again, you have to recognize that the waning issue, as well as the age range of these individuals, they were really getting their first doses in January, their second dose in February, so they're already at high risk and already 8 months out when we were recommending 6 months. So we do see those cases come up. We're hoping to address it as fast as possible, but it reiterates the fact why it's not just the individuals in that long-term care facility that are clients or residents, but also the workforce. They need to make sure that they are also getting those boosters as well.
And are we seeing any reluctancy in getting those boosters?
Not necessarily reluctancy for getting the boosters. I think it's information. I'll share anecdotally, I took my mom to get her booster yesterday, and she was, pretty much like, I'm surprised there's not more people out there. And I think a lot of people didn't fully recognize that with the release of Moderna this week, which was the #1 vaccine we provided as a community, that they are now eligible to come and get their boosters. The health department's open from 9 to 4, our vaccine clinic. We offer all 3, so you can do your mix and match if you so choose. But Walgreens, CVS, and of course our primary care providers and Heartland Health Services all have access to give boosters.
People are also getting their flu shots right now, and I guess this question goes both ways, both for adults but also for kids, if they're going to get their flu shots maybe at the same time to go in and get a COVID vaccine. Is it safe to get both at the same time? Can you get them in the same arm? Last year the recommendation was different arms or different days. What's the recommendation now?
So in terms of your influenza vaccine, as well as pneumonia for some individuals, it is safe to get all of them at the same time. Having said that, you should be a judge of your own body's reaction to how you've previously reacted to an influenza vaccine. If you are tired or kind of get slight fever or headaches or chills the next day, you may want to wait. But wait, don't not get it. That's the key. So we highly recommend that if you plan to get all 3 of them or all 2 of them, make sure you do and follow up with those plans. But there is nothing that's preventing you from getting them at the same time. Well, thank you all. We'll meet again next week, and hopefully we will be able to share great news about where our community, especially family members and guardians of 5 to 11-year-olds, can go get their vaccine. So take care.